You can start.
So, hello everybody, and welcome to Dr. Shantanu Abhyankar. I have been trying to get Dr. Shantanu Abhyankar to speak on this platform for quite some time, and because of various reasons, well, it came to this date, and I'm very happy about it. As you know, this will be not just on this Zoom link, but it will be shown on YouTube also, and it will be there. So, I request all of you to circulate the link to many more people. Let me introduce you Dr. Shantanu Abhyankar briefly because when he speaks, he introduces himself, of course. Any speaker does that. So he is a renowned gynecologist, practices not in Mumbai or Pune or any such big
Why?
city, but at Y. And he did his medical education from Pune. He has been practicing in this Y rural area for past 25 years. And I can tell you, he writes wonderfully well. He writes in Marathi on Facebook, and he has so many books. Um, he's like one would think, since he is practicing in such a faraway place as Y Satara, he may not be keeping abreast, but no, he has been up to date with the recent trends in his specialty, that is gynecology, and he offers the most modern management to his patients. He has been the president of Local Obstetrics and Gynecology Society, has chaired the National Committee on Sexual Medicine formed by the Federation of Obstetrics and Gynecological Societies of India. He has been invited as faculty for several national and international meets and has contributed chapters in specialty textbooks. I know him through his writings, and he has really extensively written about women's health for lay public. Um, his style is really lucid, I would say. You should go through some of his writings on Facebook. If you know Marathi, you would be really rewarded if you do that. Um, he has been he is known for his innovations in techniques for several surgeries and management protocols, and his contribution has been awarded the Dr. Anandibai Joshi Gaurav Puraskar by the government of Maharashtra way back in 2007. He is widely known as an excellent writer, as I told you. He is a great speaker, orator, blogger, and has many independent books. Actually, I knew him as a translator. I myself have been a translator, and he translates excellently. It's very, sometimes it's very frustrating to see others' translations, as I would say, but Dr. Abhyankar's translations are really rewarding. His most acclaimed books are on women's health. The name is also very nice, Pari Meri Gupchuri. The original thing is Ari Meri Gupchuri. Don't talk about it. Nobody should talk about women's health, their menstruation, etc. But he has written a whole book on this, the misconception, and the name is Pari Meri Gupchuri. This itself has received several awards. Well, many of you may know that I have translated Richard Dawkins' The God Delusion, and you can easily feel that why I'm a fan of Dr. Abhyankar, because he has also translated Richard Dawkins' The Magic of Reality. His title is also nicely Jadui Vastav. He has also translated Jared Diamond's Why is Sex Fun? Jared Diamond's another big wig writer, and translated the translation as Sambhog Ka Sukhacha. That is another topic about which people don't talk, but he has written, he has translated this Jared Diamond's book in Marathi. That is also selling well. He has his own YouTube channel. So today I have invited him on our YouTube channel, but he has his own YouTube channel and he has like 9 million hits. I don't know how much that it is really. So this channel has dedicated playlist for adolescents and pubescent girls and boys, tackling their anxieties and misconceptions about sex and sexuality. So now after listening to him, I'm sure you will know where to direct your children or your friends' children when they face this problem or these problems. I welcome once again Dr. Abhyankar. Dr. Shantanu Abhyankar, are you there?
Yeah, I can hear you.
Yes. So over to you, and please continue. Nobody will be disturbing you in between, but there will be some questions put in the chat box at the end of the session, so that you are not distracted by for reading the questions. Okay. So the last 20 minutes, maybe I will facilitate asking questions in the chat box. And of course, YouTube viewers will be able to access them later. Maybe Alan would help us with that. So thank you once again. Most welcome. And please continue.
Thank you, Madam Mugda, for this wonderful introduction. And here I am this evening. Thank you all for joining me here to listen to me. I'll be talking about Sarva, Pathy, Samabhava. And you heard of Sarva Dharma Samabhava, of course, and probably wondered that is there any such thing as Sarva Dharma Samabhava? Can all religions really be treated equally? Or is it something as ridiculous as Sarva Krida Samabhava, wherein can you actually treat games such as chess, high jump, golf, and football equally? Really not. They don't require the same skill sets, and they are actually totally different. Apart from breathing, there is hardly anything common between the four of them. Similarly, the principles of modern medicine are pretty different than the principles that other pathis would wish to follow and that they perpetrate. So I'll be talking about the principles of modern medicine and what its detractors usually argue against. So I'll bring in a few of the counter arguments as well. And I'll also talk extensively about what the practitioners of modern medicine hold against what is called as traditional, complementary, and alternative systems of medicine. Now, these systems of medicine, because they don't have highly effective and safe drugs, they actually thrive on deriding modern medicine. And a media campaign has been unleashed to deface, malign modern medicine, especially by the practitioners of these traditional, complementary, and alternative systems of medicine. They claim themselves to be alternative to the modern medical system, but at the same time, their practitioners demand a bridge course, and the government grants them a bridge course to walk across the divide and join the modern medicine stream. Now, I wonder if all their claims are so true, why do they actually want to cross over and join the mainstream medicine or modern medicine, as I would call this? So, I am here coming out with a strong rebuttal of all those purported claims, as well as all those arguments that are held against modern medicine. But to begin at the beginning, usually, though I have been mentioning as the current science as modern medicine, the current practice of the standard practice of health as modern medicine, it is usually termed as allopathy. Now, allopathy was a term coined by the founder of homeopathy, Dr. Samuel Hahnemann. It was coined as a derogatory term, and it actually summed up the prevalent practices in his times, sometime around the third war of Panipat. It was around that time, the prevalent European practices, he described them as allopathy, meaning thereby that doctors, he said, that gave only opposite treatments. Like if somebody is having diarrhea, they give drugs to stop diarrhea and cause constipation. If somebody is having headache, they will give drugs to stop the headache, and that's about all. And they don't actually treat the root cause of the disease, and blah, blah, blah. A lot of arguments he made. Now, his arguments were not wrong. He actually diagnosed the problem with the then current day medicine correctly. But the solution that he gave was all wrong. We'll not go into those details, but current medical practice is in no way allopathy. We do not stop at giving the opposite medication. Consider a simple complaint such as headache, which each one of us has suffered so many times. But then, does the doctor stop at treating headache by just giving an analgesic? No. What the doctor does is he goes on a cause hunt. Is it due to upper respiratory tract infection, common cold? Is it due to changed glasses or changed number in lay parlance? Is it due to a tooth problem? Is it due to an ear problem? Or is it due to something more nasty, something more serious, such as a brain tumor? So all this will be revealed over a course of time, and the treatment will be as varied as a tooth extraction to a very complicated stereotactic brain surgery, say. So this is not allopathy, though it is called allopathy. That is why I all the time use the word modern medicine. That gives the correct, or evidence-based medicine. That gives the correct perspective on the current medical practices, as against to traditional medicine, which are practices which are presumed have a presumed safety and efficacy because of their long time use. Very few traditional practices have been put to test, or complementary medicine, which suggests an adjunct use, as an adjunct, like they'll provide some relief in some conditions for some patients for some time, and they're helpful more sometimes. Sometimes they're not very helpful, as opposed to alternative systems of medicine, which suggest that they are all encompassing alternative to the present way in which human wellness and illness is understood. So they have a anatomy of their own, a pathology of their own, a pharmacology of their own, and a correlation between all these things. Now, most of the times it is all traditional and it's given in certain olden books, and that is why it is held very highly and very dearly. The Right from the anatomy, everything goes wrong. The anatomy is wrong, understanding of anatomy is wrong, so the understanding of physiology, that is the normal functioning, is wrong. Therefore, the understanding of pathology, that is the malfunction of the body, is wrong, and therefore the pharmacotherapeutics is also goes wrong. But the practitioners of these systems, they actually thrive on deriding modern medicine. The first thing that they will come up with is that modern medicines have a lot of side effects, or untoward reactions is the correct technical term. Meaning thereby that if modern medicine has side effects, the others, whoever they may be, are safe by default. It doesn't work that way. Of course, modern medicine has side effects, and why there are varied effects, like and all drugs, they are finally chemicals. All drugs, whichever pathy you label them as, they will have untoward reactions depending on the dose, depending on the conditions, and so many other factors. If certain drug is claimed to be having no side effects, it actually means that you can rest assured that it has got no effect at all in the first place. It is as innocuous as that. And all side effects are not bad. Take the example of oral contraceptive pills. Oral contraceptive pills, as a side effect, not as a contraceptive action, as a side effect, they prevent ovarian cysts. They reduce the menstrual flow and prevent anemia. There are less chances of having ovarian cancer and endometrial cancer in women who are on long-term oral contraceptive pills. They reduce the premenstrual tension and premenstrual syndrome and such other premenstrual problems. So that is why these side effects are actually beneficial side effects. Or think of aspirin. Aspirin was used as an analgesic. It is still used as an analgesic. But in low doses, aspirin has an action of preventing blood from clotting. And this is used favorably, which was a side effect actually. And it had caused a lot of problems in a lot of people, including the Russian Tsar. But then this was used to our own benefit when aspirin is used in cardiovascular diseases to improve microcirculation. So all side effects are not bad. I would put it this way that yes, modern medicines do have side effects, but it is not because they belong to modern medicine. It is because the side effects are studied, well documented. There are continuous studies, like even when the drug is marketed, there are ways in which doctors, practitioners can give feedback about the untoward reactions that they come across. And this goes, and it's an ongoing process. There is monitoring, there is documentation, and then there is an effort to find a way to mitigate these particular untoward reactions. So this doesn't happen in any other traditional or complementary or alternative system of medicine. So it is not that they don't have side effects. It is just that they are not studied. They are just simply neglected. They have severe and sometimes fatal effects. I don't know, but many in the audience may be familiar with the work of Dr. Abby Phillips, who was recently in the news because he was sued by the Himalaya Drug Company. I mean, the Twitter was sued by Himalaya Drug Company because, according to the drug company, he had unleashed a campaign against their product because he published data, the well documented data, that showed that certain products of this Himalaya Drug Company were harmful, toxic to the liver. Now, such studies are there easily. So many studies are found in Europe and America. In India, Dr. Abby Phillips seems to be doing a wonderful job. After having come out with this data, only recently the authorities came to him to check whether everything was okay, when in fact they should have gone to the manufacturer to check if the drugs actually contained what was alleged that they contain, very high doses of heavy metals, and so many papers he's come out with, and very good studies he's come out with. But this is the approach of traditional complementary and alternative systems of medicine, and this is not the scientific approach at all. There are certain other labels that these systems carry with them, by default. They always say that the system is holistic, meaning thereby that they treat mind, body, and spirit. Now let's leave aside the spirit part, that is more controversial, but they treat mind and body together. Now, even modern medicine treats mind and body together. Imagine a patient, a 40, 50-year-old gentleman who is obese, put on weight very recently, does not exercise, and he goes to a skin specialist and is diagnosed to have recurrent fungal infection. Now, since there is fungal infection and it is recurrent, the dermatologist suspects that he probably has diabetes. So he is investigated for diabetes by a pathologist. The reports comes positive and shows that he has diabetes. So he is referred to a physician or an endocrinologist to treat his diabetes. The endocrinologist just doesn't prescribe drugs and sit silent. He knows that this particular gentleman has got diabetes at such an age. So this particular process is going to harm his eyes. And it is better that he documents whatever his condition is today, which will help him in preventing retinopathy, that is problems with the eye. So he sends him to an ophthalmologist. Okay. Now, is this not holistic care? It is not because modern medicine doctors have some sadistic pleasure in dismembering the human body and treating each part separately, as is commonly perceived by the CAM practitioners. It is because it is practically impossible for a single human being to imbibe all this information about skin, about the blood test, about the drugs for diabetes, about the problems with the eye in diabetes, and put them in practical use. It is humanly impossible, and that is why there are such subspecialties and super specialties in modern medicine, because there is such a volume of knowledge and skills that you need to acquire to specialize in these fields. Now, I would say that this is modern medicine. I mean, this is holistic medicine. And at the end of the day, maybe the endocrinologist realizes that this particular man having gained weight all of a sudden, and the shock of being diagnosed as a diabetic, and that he'll be on drugs lifelong, is actually psychologically challenged, is depressed, is anxious, and may require psychiatric help as well. So I believe that even modern medicine is holistic, and no separate label needs to be applied to such practices. Another thing about is that all these traditional medicines are considered to be safe because they are natural. Now, synthetic modern drugs are also products obtained either from nature or now mostly synthesized in the laboratories, but they are basically chemicals. And the herbal drugs, so-called natural products, they are also basically chemicals. So a chemical is a chemical and it will have the same action, whatever label you put it. And penicillin, it comes from a fungus. So why not label penicillin as herbal too? But modern medicine doesn't tout penicillin as safe because it is herbal. It has a very humble proposition that penicillin can be used in such and such disorders under such and such circumstances, knowing that these are the adverse reactions, and it will help most of the times. That is the humble approach that modern medicine will have. Modern medicine does not say that penicillin is safe because it is natural, because it is herbal. There are so many natural things that are actually harmful. Snake bites are natural, polluted water is natural, flea bites are natural, flus are natural, but they're not good. So everything that is natural doesn't automatically become safe. A lot of ado is made about balance, santulan. Santulan, and then all these traditional practitioners will name their clinics as something meaning balance, this and that. And then they balance various things, yin and yang in Chinese medicine, black bile, yellow bile, blood and mucus according to the Greek and Unani medicine, and kapha vata pitta according to Ayurvedic medicine. But then even modern medicine balances everything. You visit a simple operation theater or a very high-end neonatal intensive care or cardiac intensive care unit, and you will see how finely the oxygen and carbon dioxide levels, the sodium, potassium, and chloride levels, the intra and the extravascular fluids, the intracellular and the extracellular milieu, the acetylcholinesterase and cholinesterase ratio, everything is balanced so perfectly and monitored minute to minute. So modern medicine doesn't work on such imaginary concepts as black bile, yellow bile, or yin yangs and like that. Also, the traditional medicines are touted as being individualist. Especially homeopaths like this word, individualization. And they believe that they have medicines, different medicines for the same condition in different individuals. Fantastic idea. But then their way of differentiating one medicine from the other is by asking the number of blankets that that person has at night, or the number of stools that the person passes, or some such unrelated questions that they will ask. Modern medicine also has tailor-made drugs. There are mutations in certain cancers, say in lung cancer, there is this EGFR mutation. So there are certain mutations. Then there are drugs that target that particular mutation. So that drug is not going to be helpful to any other patient who does not have that mutation. It is specific to that particular mutation. So it becomes specific to that person or the cohort of patients who have that particular disorder. There are, I mean, that's particular mutation. So we have such targeted therapies in many of the cancers now. So individualization actually means why are we different? We are different because we have a different set of genes. So if at all one has to individualize, it has to be at the genetic level. And that is what modern medicine is now capable of. Okay. So it is not just empty rhetoric. Most of the times, the CAM practitioners, that is complementary and alternative medicine practitioners, they argue that they are have the very highly effective drugs, but cannot somehow explain the effect of the drug, why and how it acts. They are not able to explain. That is inexplicable, or more science is required to discover that. These are their common arguments. First of all, as long as safety and efficacy of the drug is established, it is not necessary to know the mechanism of action. To give you classic examples, drugs such as penicillin, which was extensively used in World War II and later, nobody knew the exact mechanism of action of penicillin in those days. The mechanism of action was discovered way later. Morphine was used for a long time without us knowing mechanism of action. Even today, I am a gynecologist, and there is a condition called eclampsia, wherein a woman has convulsions during pregnancy, and the most effective drug, magnesium sulfate, which is the drug of choice in this condition, we still do not know the exact mechanism of action of magnesium sulfate in eclampsia. So mechanism of action is not necessary. What is necessary is to prove safety and efficacy. Now, whenever proof of safety and efficacy is talked about, the counter argument is that double-blind, randomized, multicentric controlled trials are impossible in such type of therapies. Of course, double-blind, randomized, multicentric controlled trials are the best possible evidence that one can come up with. When the drug passes these such trials, that is the best evidence for the drug. But then that is not the only way in which drugs can be tested. Now we have statistical methods. Now we have different trial designs so that almost anything can be tested. So it is not that modern medicine accepts no other evaluation than this strict randomization control trial, etc., etc. But then there is a hierarchy. There is a hierarchy of evidence, and depending on the evidence, there is hierarchy of recommendations also. You go to any modern medicine conference or go through any textbook, you will find that they will say that for this particular therapy, the level of evidence is level A, level B. So A, B, C, D, there are levels of evidence, and the recommendation is level A, B, C, D, whatever. So there is a hierarchy. Many of these traditional practices, they are very commonly used for, say, knee joint. Now, knee joint pain is a very common condition. Arthritis is a very common condition. If they cannot separate the ingredients, at least let them prove that it is useful for arthritis. Say the approach using medicine A, B, C, D, whatever it is, different medicine for different patients, but with the same condition. If it's proved to be working, it will show that that approach towards that particular condition is okay, it is acceptable, and it is scientific. But usually these claims, they are rooted in culture, tradition, scriptures, and therefore they are not only considered valid, but they are considered holy. And because they are considered holy, they are considered above challenge. So that is not the way science works. That is not the way science develops. And no wonder such systems, they stagnate and they just don't develop further. Another argument against modern medicine is that modern medicine is either too rigid or too fluid, ever changing. I would say that it is too fluid, and which is correct actually. So many of my friends and my patients, they used to come in COVID times and ask me, what is going on? Can't you doctors figure out which is the best drug? It's a pneumonia, it's so common. One day you say that use chloroquine, the next day you say that use remdesivir, the another day you say that this vaccine is good, then you come up saying that this vaccine is bad, and so on and so forth. I must say that that was actually a live demonstration of how science works. Science is not perfect. Science usually takes the path somewhat stumbling, whichever way evidence leads. And evidence cannot be gathered in a day. It's a long time process. Science or modern medicine doesn't claim to be being infallible. But then remember, one of the best tests of scientific argument is it being fallible. You should be able to test it. You should be able to disprove it. Only then can such statements be considered a scientific proposition. Modern medicine rejects metaphysical factors as the cause of disease. Modern medicine will not say that this is because you have sins in the previous birth. That is not a cause of disease according to modern medicine. And that is why modern medicine belongs to the globe. It belongs to the entire earth. It belongs to all cultures. And it is popular everywhere and it has made changes across the continents. It rejects metaphysical causes as causes of disease. So you will not find mention of humors, nerves, miasms, vital force, etc., in physiology textbooks now. They have all been rooted out now. So we consider causes as tangible, even for psychiatric disorders. It is not some exorcism or something that is going to help. So the good old adage, all biology is chemistry, is proving true. Even in case of psychiatric disorders, we now know so many enzymes and neural pathways and their exact dysfunction that happens and the changes in the neuroendocrine system that explain human behavior and what goes wrong with it. Modern medicine respects life. It gives a realistic idea about the diagnosis and prognosis. We don't claim something that we cannot actually, that do not actually know about or cannot actually bring about, with the pros and cons, with the problems, with the side effects. So it's open. It is not paternalistic. Modern medicine practitioners will involve the patient in the decision making process. So they are not passive recipients of care, they are partners in the action. Of course, such great transparency at times is a hindrance, and patients, often, especially Indian patients, prefer not to know rather than to know everything. Not to know at all rather than to know everything. Another common argument is that since modern medicine cannot treat every disorder all the time, okay, it has limitations. Of course, it has limitations. It doesn't claim that it knows everything, but modern medicine knows what it doesn't know. It exactly knows what it doesn't know and keeps working towards that. But that there are gaps in knowledge, that there are gaps in our understanding, that there are therapies yet to be discovered, yet to be invented, does not mean that these gaps can be filled by imagination, by imaginary forces, by imaginary, energies and whatever language they use. So it is not, it is actually they're trying to fill up the gaps in knowledge by imagination, which is not the way of doing it. Accepting ignorance is the first step towards knowledge. So modern medicine spells out its limitations all too clearly. It accepts that diseases are intimately related to lifestyle. Yes, diet, lifestyle modifications are an integral part of management by modern medicine, management of long term disorders such as hypertension, diabetes, and so many others. Dietary and lifestyle changes advice is, of course, offered. Modern medicine looks at what is called as the epidemiological triad. That is three factors. The agent, what causes the disease. It becomes very clear when I give an example of some infectious diseases, such as, say, cholera. So you know that Vibrio cholera is the agent. That is what causes the disease. The host, that is the person. So some problems with the person's immunity, some problems with the person's ability to fight that particular disease. Those are the host factors, and the environmental factors, that is sanitation, water supply, and open air defecation. All these will contribute as causes of cholera. So it is not just Vibrio cholera. It is all these things put together which causes an epidemic of cholera or tuberculosis. And why cholera or tuberculosis? Even modern day epidemics such as road traffic accidents. Road traffic accident is an epidemic of non-communicable diseases. The epidemic of diabetes, the epidemic of hypertension, they have all reached epidemic proportions, and all are analyzed depending on this particular model. And also, modern medicine will approach a disease by looking at it through 5 levels of prevention. 5 levels of prevention. So it means that the first level is health promotion. So good nutrition, good exercise, good environment, good air, clean, safe water, nutritious food, etc., would form health promotion. Then is specific protection. So there is a vaccine. There is a vaccine against cholera, say, or against tuberculosis. So that is specific protection. There are diseases against which there is no vaccine. So this step doesn't work in those conditions. Early diagnosis and treatment. Yes. So mass screening for, say, hepatitis B, vaccinating those who are negative, or mass screening for diabetes or hypertension. It works. Mass screening for cataract in rural areas. It works. So early diagnosis and treatment. Just diagnosing the condition doesn't help. You actually have to treat it. So arranging for those cataract camps on mass basis is a good measure. Then there is disability limitation. If you can't actually help the person, at least try and limit the problem, mitigate the problem. Say, for example, in a patient with cataract, later on the person develops glaucoma, and despite doing the cataract surgery, the vision is poor. So disability limitation means monitoring the glaucoma condition, treating it continuously so that the vision doesn't deteriorate further. This is disability limitation. And rehabilitation. You have to provide services for patients who cannot get over this difficulty, this disability, so that they lead a healthy, normal life in their own surroundings, at their own home, and such other. So it is not that modern medicine doesn't have any philosophy, doesn't have any principles, doesn't have a view of looking at human life. This is the philosophy of modern medicine. Following these principles, we have been able to eradicate smallpox from the face of the earth. Polio is on way out. India is a certified country with no polio now. And just 2 nations. I guess now it's just one nation which has got polio as a problem, as a public health problem. Like I told you, diabetes, hypertension, road traffic accidents are also and will also and can also be dealt with applying these same principles. Consider the traditional complementary and alternative systems of medicine. And if each of this system or each of this cult had the efficacy that its proponents claim, actually they would sort of, extinguish each other. But that doesn't happen. Almost more than 150 systems are still in practice, still in vogue across cultures. It is not a problem just in India, it is everywhere. So these systems, they still persist, they are still practiced, and their practitioners still make very, very tall claims. The problem with these particular traditional and other alternative systems of medicine is that If they prove some certain drug to be useful, say suppose some particular practice A is proved to be very, very useful against some disorder B, then it becomes a part of modern practice. It becomes standard of care. It is actually adopted by modern medicine. Now, modern medicine is not some idea which flashed all of a sudden sakshatkar to some one particular person. It is a conglomerate of so many ideas and so many inputs from so many people across the globe, across centuries. And modern medicine has extensively drawn on traditional medicine because that was what was there everywhere. So it is the distilled, the time tested and scientifically validated medication that has been used by modern medicine. The era of drug synthesis, drug designing is very recent. So modern medicine has extensively drawn on these practices. There is no point in deriding them, but there is certainly one should study them and one should claim what one actually has evidence for. You have heard of the drug artemisur. That is the drug that comes from the traditional Chinese remedy for fever, and this particular drug is now the first line treatment for malaria. Now, this and the discovery received the Nobel Prize for this Chinese physician, the Chinese doctor who did this. So it is in this way that science will go forward. So many times where I say all this, people ask me that that's okay. You say that it is not useful, but then it is not harmful either. So, what is the harm in taking these particular medicines, accepting whatever is being offered? Well, it certainly is harmful. First of all, it actually weans away patients from better and more effective and safe management. So the patient is weaned away from the standard of care. Unlabeled ingredients are very common. I gave reference to Dr. Abby Phillips' work. You can go through his work on social. It's easily available on social media. And since they are, the doctor doesn't know what risk it carries. Since that it's unlabeled, the doctor doesn't know what risk it carries and what is being offered to the patient. There is a false sense of security. Since you are being treated by a doctor, you believe that you are in safe hands and that whatever is best possible is being done, but which is not the case. So there is a false sense of security. And many of these traditional practices, they will not have any prophylactic management. Like, say, the pap smear for cervical cancer. Now, this particular test, it detects cervical cancer some 10, 15 years before it is visible to the naked eye. So one has an advantage of this 10 and 15 years to diagnose it correctly, treat it properly, and prevent any further progress and prevent it altogether. Now we have a vaccine, but pap smear is one such test. So this is offered to asymptomatic patients. So the patient is not expected to have any complaint. It is through mass screening that such patients are picked up. Despite all this, the CAM practices and practitioners and education thrives because the government looks at this as a way of getting cheap health manpower. That is what it is. And what do the practitioners do? They soon learn that they can survive only by using modern drugs. So they keep on asking for bridge courses. Otherwise, it becomes a burden, and the medical legal risks are very high nowadays. Or they just fill in the gaps in the system, like they become counselors, they become assistants to certain consultants, and they keep on working in filling in these gaps. There are postgraduate courses. I know of postgraduate courses in Ayurveda wherein a person does BAMS, that's an undergraduate degree in Ayurveda, and then does a postgraduate in obstetrics and gynecology and a postgraduate in surgery. But mind you, these doctors, they do not put into practice the principles of Ayurveda in conducting their surgeries or in practicing obstetrics and gynecology. They use the drugs that modern medicine doctors use. They use the practices, the anatomy, the physiology that modern medical practitioners do. So they are actually not following their own principles, their own parental guidance, but they become well trained in some such practices, and they are able to thrive and practice, but again at some great medico legal risk. Now, what do I suggest as a solution? I am no expert in public health or in managing medical education, but I sincerely feel that outright unscientific practices, pseudoscientific practices such as homeopathy should be banned. Let there be just one undergraduate course. So everybody learns the same thing as an undergraduate. And let students have an option of pursuing Ayurveda, Unani, or Siddha as postgraduate students. See, traditional medicine is something that is inherited. We just can't wish it away or do away with it. It's a part of our culture. So it's not going to go away. But the students, when they have learned their ropes as undergraduate students doing learning modern medicine, they will be better trained to and better and scientifically oriented to interpret these systems, to study them well, and maybe we can come out with an Indian version of Artemisur or some such drug later on. I believe that that is the way to go further. The World Health Organization defines health as a state of complete physical, mental, and social well being, and not just the absence of disease or infirmity. That is the World Health Organization's definition of health. And it's an ideal, it is like Ramaraj, where everything is good. So one cannot actually, nobody can be in complete physical, mental, and social well being. So it's perhaps an unattainable goal. And therefore, the World Health Organization itself come out, came out with a working definition of health, a practical definition of health. And it says that anybody who leads a socially and economically productive life to the best of one's abilities, remember, to the best of one's abilities, is healthy. So a person who is myopic and wearing glasses is healthy. A person who has scars due to acid burns but is able to earn his living and lead a respectable life in the society is healthy. All amputees, all addicts who have got over their addictions, people with knee replacement, people with different sexual orientations such as LGBTQ, they would all, by this definition, be healthy. And I believe, like Darwin said in the last paragraph of his iconic work, The Evolution of Species, there is grandeur in this view of life. I believe that there is grandeur in this view of wellness and illness, and we should respect and celebrate our insights in our own wellness and illness. I thank you all for being here, and I also thank Madam Mugda for having invited me here. It was an enjoyable evening, and I believe that we are open to questions now. Thank you so much.
Hello. So
Hello.
there are two questions for you here by
Yes.
uh, R. Venkatesh. And the first is, nowadays one sees mushrooming of scientific naturopathy path and is patronized by several high-placed educated people too. So that is what actually drove us to do this. So
Yes.
he's asking, what is the real scientific basis for this naturopathy path that wellness centers propagate? Do they use real science information, or is it again belief approach?
And there is an illness industry wherein you got to go to the hospital and lie on a bed and receive treatment. And so also there is a wellness industry wherein you are perfectly all right, but you want more perfection in life. So you take tonics, you take multivitamin pills, and such other things. Only recently, I read an advertisement which says that you take intravenous vitamins,
Oh,
okay,
hmm.
on some weekly or daily basis, and you will feel great. That is what it showed. So, unethical and unsupported claims are everywhere, and so also in this particular field. Naturopathy, meaning using the natural agents to heal, they are good practices. Our grandmothers have been using poultices and so sitz bath and water baths and so oil massages and things like that. But then I would say that they are adjuncts to the prevalent therapy, and they are not alternatives as such.
Yeah, our Venkatesh goes further and asks, main two reasons of push of unscientific medical approach are traditional unscientific medicine is a multi-million business, as you said. So they are deriding real modern medicine. Religion is a big mover. Traditional medicine is pushed under patriotism or push of own religion, one's own religion, as against Western intrusion. It's beyond argument of rationality and science, unfortunately. Well said, Venkatesh.
Yeah, yeah, very true. I fully agree with you and endorse your view.
Wonderful.
Uh, but then I would say that modern medicine is not Western medicine. It was once dominated by doctors of the West because they had an advantage, all the historical facts. But now it is no longer Western medicine. People from across the globe, across countries, Asians, Africans, everybody contributes to the pool of knowledge that we have. And now it is our own global heritage. And that is how every type of science is. Just as there is no European mathematics separate from Pakistani mathematics, separate from Indian mathematics, there cannot be a separate biology, anatomy, physiology according to one system of medicine and which goes against the other system of medicine. There can just be one.
Mm.
And this point about medicine, the traditional medicine being garbed as tradition, religion, culture, nationalism, that is what is happening on a huge scale. And that has emboldened the practitioners of these sciences, so called sciences.
So-called sciences, yes. Now, all those Babas having Divya Aushadhi ashrams, and
Yes,
that is all the reflection of this same misconception.
yes, yes, yes,
Vaishali
yes.
Gunakikar has come out with a very interesting information. I didn't know this. There is a lounge of IV to feel fresh at Juhu. They also have
Yes.
facilities for group IV.
Yes, that is the advertisement that I refer. Thank you.
Okay. So group IV is to make you feel part of the whole or something.
Tribe.
Right.
So
Good.
there are many other fools around, and that's reassuring.
Mhm. Yeah. But this is a most modern approach, I can say.
Yeah, I think so.
Yeah.
I'm sure that some of those are shills, they are actually placed by the owner himself or herself, so that the patients get a feel that there are many people doing this.
Mm. But I remember like the rare examples of modern medicine doctors practicing in the rural areas, especially. Like when a patient comes, they used to tell them, Doctor, ek saline lawa. Then I feel
That's very common. That's
very
very
common.
common.
And, I mean, people did cater to it. The doctors did cater to it.
The therapeutic effects of a needle prick are well known.
Placebo.
Placebo effect. Yeah.
Mhm. Okay, I think there is one more question here. It's a new trend. Okay. A new trend even in Bollywood. That's Alan telling us. Vitamin
Mhm.
IV fluid.
Vitamin IV fluid. Yeah. Intravenous vitamins.
So, can you, in very plain words, tell them what is this about IV
It
intravenous?
is utter foolishness.
Atropine. That's what the doctor needs to
The,
say
see,
loud and clear.
vitamin A, D, E, K. There are four vitamins which are fat soluble: A, D, E, and K. So if you have plenty of them, you have developed toxicity because they are stored in your body. The rest of them, multivitamins, B complex and such other vitamins, they are actually passed out through the urine. So if you are in Mumbai, they finally meet the Bay of Bengal. I mean the Arabian Sea, sorry.
Yeah, that's a very
They
nice.
go down the drain and reach the Arabian Sea. That is where the vitamins go. Because your body can accept only so much. Anything that is excess is overflow. And it overflows into the kidneys, into the urine, and out into the Arabians.
I don't know whether it goes to Bay of Bengal because I don't know
No,
how
if there are somebody from
recirculate.
Chennai or Kolkata, maybe it goes there. I'm sure Tollywood and Collywood also have these trends.
Oh, must be. Once it is in childhood.
Yeah.
In fact, today I saw a reel which showed this as an industry to invest. Uh, I missed it. Just a minute.
19th century. I can't read these messages.
To invest and make money in the next 5-10 years. As such,
Hmm.
bars have popped up in London, New York, Dubai, and the likes. My God, madness is, it catches
They
on.
spread like, yeah, yeah. Madness also have epidemic proportions.
Yes, absolutely. That is the worst epidemic, one
Yes.
could say. R. Venkatesh is again here. He says
Yes.
pushback against real modern medicine reached a high point late 19th century to early 20th century. It will continue,
Okay.
Venkatesh, and led to the Bombay Medical Act 1912. That's how modern medicines registered. Yeah, but see now, what is the use? Like it's still going on after 1912. More than 100 years have passed. There is still more. That's how
Yes.
then registered practitioners got positive push. Mridula Ramanna has written a good research book on this conflict and evolution of medicine.
If
Um,
you could be kind enough to share the name of the book and the author in the chat box, I would be grateful.
yes, please do. Same debate 100 years ago. That's what he is saying.
Yes.
Mm.
The Our rulers, the Britishers, actually they did push their own system of medicine and at the peril of the local practices. So the local doctors, they actually did not get the chance and could not put together a effective fight back and study their own practices, their own medicines, and therefore it fell in disrepute. And I believe that it continues to this day. The problem I tell you is, these traditional practices, they are let off the hook by the government and the Food and Drug Administration. If I have to market some drug as a, say for example, pain as a modern medicine drug, I have to come up with level 1, level 2, level 3 studies. Then I'll be able to market it and have post marketing surveillance, like I mentioned at the beginning of my talk. But if I have to market something as useful and as traditional medicine or as homeopathic, all this Ayush system of medicine, then I don't need to present any study. What I need to present is just some reference book saying that it is useful in such and such a condition. And that's about all. And I can market it. Now, if I can market something and make money without investigating it properly, scientifically, and producing evidence, why would I spend the money in that research? Research is absolutely costly. And human research and stage 1, stage 2, stage 3, it takes years and it is very, very costly. I follow this, and nobody is willing to do that. And why would one? Because they are making money without the expense. So it's all profit.
Hmm. Healthcare in Bombay Presidency in 1896 to 1930.
Okay.
Uh,
Thank you. I'll try and procure the book and go.
hmm,
Thank you.
that is the book. Okay. R. Venkatesh, please put it in our group also of exposing falsehoods. So basically, what you are saying is all these uh, native systems could not evolve scientifically. They could have been,
They
but
could have, of course.
because of the
Where,
intervention
yeah,
of the empire.
where did medicine evolve in the Western world from? It
Exactly.
evolved from their own traditional medicine.
They also had the same misconceptions.
Yeah, they had the same problems. They continued and they got over them in a
There was
certain way.
resistance for each and every
Yes,
modern
yes, yes,
development.
yes, 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 yes. So,
And
but same
we,
could have happened here, but
yes,
we didn't get that historical opportunity, I would say.
historical opportunity was also lost after the independence because
Yeah.
those people practicing stuck to the tradition,
Yes.
the
Yes,
ancient
yes,
word,
yes.
and that was the death of it.
Hmm.
Not
Hmm.
death
Hmm.
really, but
Very
it's
true.
a
Very true.
kind of false living.
Yes.
Okay, thank you, doctor.
Thank you. Thank you so much.
So
It was
happy to
wonderful
have
to be
Dr.
here.
Shantanu Ambedkar with instruction. And I think we should offer one more lecture in Marathi because that
Sure.
audience is not catered to in this lecture. And he wouldn't join simply because it was in English. And actually, that is the audience we need to
Hmm,
pay
hmm, hmm.
attention to. Thank
Sure. I would love to be here again. Thank you so much.
thank you.